Welcome, everyone. A big thanks to those of you who are listening in to our Partner Learning webinar. This is Victoria Lowe with Healthier Here, and I have a colleague with me today.
This is Tavish Donahue, also with Healthier Here.
And we are very excited to have with us a wonderful team from Public Health, Seattle, and King County. They will be sharing some training opportunities around managing asthma through home visits. For those of you unfamiliar with this model, it has gained widespread recognition not only in our region, but really throughout the country. It's a model that has been around in the community health world for many years, but has recently also drawn the attention of folks working in population health because of its ability to improve outcomes while reducing healthcare utilization. So without further ado, our presenters are Dr. Jim Stout, a pediatrician and professor at the University of Washington, who is the co-principal investigator on the PCORI Disseminating Community Health Worker Training from Guidelines to Practice project that we will be discussing today. The other lead principal investigator, Bradley Kramer, is unfortunately unable to be here with us today. We also have folks who will be doing the actual training: Maria Rodriguez, Michelle Demiscio, both of whom are community health workers, and Joyce McCraney, an education consultant who has prior experience as a community health worker. They are rooted in our local communities and are highly experienced with decades of work on asthma between them. And last but not least, we have Nuha Elkujia, the community health worker training program manager who has prior experience managing a community health worker program at an federally qualified health center in partnership with public housing service providers. So before I pass it along to them, I also want to mention that both the slides and the recording of this webinar will be posted on our website. In addition, as we go along, please feel free to type in any questions that you have in the chat box. We will be answering them after we go through the slides. So here's Nuha.
Thank you, Victoria, and thank you, Healthier Here, for this opportunity for us to come here and share more about our program. I just want to walk us through the agenda for the day, and then the team will take it away and get everything started here. So Dr. Stout will begin by giving us more of a history about the PCORI research program that we worked on at Public Health, and give an introduction on what the PCORI Dissemination Implementation Grant is. Maria will share with us a patient case story and the successes of the program. Then she'll hand it over to Michelle, who will talk about community health worker asthma training, both the online and in-live sessions. Then Joyce McCraney will go over the community health worker supervisor training. And then I'll give you guys the dates for the trainings in King County and how to sign up. And we're really looking forward to opening up the floor for questions and feedback from you all today.
Hi, everybody. I'm Jim Stout, and thank you for joining. And I have the pleasure and privilege of working with this amazing team from Seattle, King County Public Health. Just a little bit of background and history before I tell you about the project that directly led into this. The community health worker model, the model began in 1994 at Odessa Brown Children's Clinic with a lay community worker that made home visits and brought information back to me that I could use in the context of preventive asthma care there. My colleague Jim Krieger got very interested in this model. He and I both worked on separate projects, pretty much asking the same question, which is, can you influence the health outcomes of people with asthma with a community health worker home visitor model, and thus began a series of studies that Jim ran at the health department, Dr. Krieger ran, showing different aspects of the effectiveness of the model, and that culminated in the most recent trial, which began in 2003. It was called Guidelines to Practice. Jim left the health department, and he was the biologic parent of this grant. I'm the adoptive parent of the Guidelines to Practice project, and its goal was threefold. One was to work with practices at Neighbor Care Health and at HealthPoint to improve their preventive asthma care through a series of quality improvement interventions that we won't get into here. and also to help health plans enhance their case management, primarily Community Health Plan of Washington and Molina, basically enhance their ability to monitor medications, notify providers of ED visits and hospitalizations, and increase guideline distribution to providers. The thing that's in bold on this slide, deploy community health workers to help people managing their asthma, was done in a randomized controlled trial fashion, so that a random half of 550 children and adults with asthma between the ages of 5 and 75, all covered by Medicaid, were randomized either to receive these 3 home visits or not. And these home visits were delivered to families that spoke as their first language either English or Spanish or Somali. And we had community health workers that were bilingual in either Spanish or Somali. And the trial ran the intervention part of the trial ran for 2 years. Each individual was in the intervention for 1 year, and we studied their outcomes at baseline and at the endpoint. And what we found, this is a very brief summary of like larger results, but what we found is that compared to patients who didn't get home visits, children and adults who did get these home visits had more days without asthma symptoms. They went to the emergency room or were hospitalized or had urgent care visits less often. They missed fewer days of school or work, and they reported better quality of life. These were all significantly different findings. And the bottom line is every single thing we measured changed significantly in favor of the community health worker intervention. That led us to write the proposal for the project you're about to hear about, but that that underpins the training we're in the process of getting ready to offer to you and to other communities around Washington State. And with that, I'm going to pass it to my colleague, Maria, who I think is going to start with a patient case.
Yes, thank you. So I will speak about this patient case, which was a patient was 1.5 years old, and he was referred to us from the Seattle Children's Hospital because he had been hospitalized 3 times for at least a week each time in the past 2 months for asthma symptoms. His family was living in a duplex in Federal Way. The home was infested with thousands of small cockroaches throughout, and Mom was trying to clean up the environment with undiluted bleach. So the solution, I provided patient education about the safe cleaning kit, which included the baking soda, vinegar, and the soap to replace the bleach used by Mom. Then I placed roach hotels, traps in different places around the home to find where they were concentrated, and later was able to use the Max Force gel, focusing in the kitchen as part of the cockroach abatement process. Then I provided the family with a HEPA filter vacuum to clean up the leftover cockroaches. This required 4 visits to the family in their home. We did 4 roach abatements in 4 months, and within those 4 months, there was no ER visits or hospitalizations for the child, and 2 months without symptoms. And so the family was very engaged in this process, and we were helpful, and it was very helpful in the entire process. And this readiness is the key to having a successful home visit. So this story I just shared with you is one of many successful stories from this program. Because of those successes this year, we received funding from the PCORI to disseminate the community health worker training across Washington State. The asthma protocols have been created and used for patients ages 5 to 75, so anyone who works with the clients, whether they were children or older adults, would benefit from attending the training. The supervisor training will also be for anyone, whether a community health worker, working in the neighborhood, community-based organizations, clinic, or public health department. The protocols and curriculum plans have been reviewed by an advisory board who meets monthly and builds on existing information in the communities we serve. So the goals are to make the tested community health worker asthma home visit model part of the asthma care in communities across Washington State. provide free trainings for the community health workers and community health worker supervisors. Trainees will receive in-person tailored training, interactive online tutorials, and evidence-based resources and materials to keep as part of the curriculum. Co-learn and partner with ACHs, CHW, community members, patients, providers, Washington Department of Health, and Medicaid MCOs. Thank you. And now Michelle is going to go over the community health worker asthma training.
Thank you, Maria.
You're welcome.
So I will share about the community health worker asthma training, both the online and in-person training. The online training covers 10 modules based on behavioral and environmental protocols developed and used at King County for the past 20 years. It is interactive with images, including video clips with local actors, and is developed by the UW IMTR team. The 10 modules include 1. Asthma basics. 2. Medication adherence and guidelines for using an asthma action plan. 3. Respiratory distress warning signs and responses. 4. Home environmental check and cleaning technique. 5. Dust control guidelines, vacuuming and doormats. 6. Dust mite guidelines. 7. Mold and moisture guidelines. 8. Roach and rodent guidelines. 9. Pets, their management, and HEPA filter use. 10. Environmental air exposure, both indoor and outdoor. For Module 10, we have local experts from Puget Sound Clean Air contributing relevant and up-to-date information for King County. Here's a clip created by the UW IMTR team featuring local actors who are playing a CHW and a patient's mother going over the asthma action slide. Going over the asthma action plan.
Oh, it seems like we're having some technical difficulties with our sound. See if we can figure it out. Oh, gosh, fix it. Oh, there you go. Sorry about that, folks.
Let's talk about Omar's asthma action plan. Thank you for finding it. Do you remember when this was written?
Actually, I couldn't find it. So when I went recently to get a refill for Omar's prescription, I asked for a new one.
Great. I'm glad that this is up to date. So, the asthma action plan is a tool to help you manage Omar's asthma with greater confidence. Once you're familiar with it, you won't need to refer to it every time, but it still should be reviewed with your provider at least once a year.
Okay. Can you remind me how an asthma action plan can help us?
Sure. The asthma action plan can help keep Omar's asthma in good control. It provides a step-by-step plan of action that will help you remain calm and give you direction when Omar's asthma worsens. Where do you usually keep it?
Well, now it doesn't really have a place. It actually sits on the counter since I just got it.
Okay. It's helpful if it has a special place so you can easily access when you need it. Maybe you could put it in your calendar.
Sure, that's a good idea.
Does Omar ever look at the asthma action plan?
No, not really.
Okay. It will be good if he knows how to use the asthma action plan. Can I show you how to use it so you'll be able to help him?
Sure, that would be great.
The different colored zones show what to do for Omar's asthma depending on how he's feeling. The green zone is for when he's feeling good and the asthma is in control. The yellow zone is for when he starts to have some symptoms and you might need to take some rest and inhaler medicine. Some doctors suggest taking more controller inhalers then too. And the red zone is for when symptoms get worse and you might need to go to the doctor or at least give them a call.
Okay, that makes sense.
All right.
The 2-day in-person training covers 8 modules, covering a wide range of content, which includes review of cultural competency, humility, and trauma-informed care as they relate to community health workers' interactions with clients and asthma home visits. goal-oriented, client-centered counseling style that helps clients determine their readiness for change and set achievable goals, specifically focused on asthma-related topics such as smoking cessation. Basic asthma information as a refresher of modules and tutorials followed by hands-on sessions with inhalers, spacers, nebulizers, etc. How to use asthma protocols during a home visit. Interactive session discussing process and hearing from experienced community health workers. Review and discuss asthma case study may contain asthma and depression. Opportunity to conduct a mock home visit with a patient and receive feedback from facilitators. How to advocate for safe housing and health care for asthma patients. Protocol for inadequate and unsafe housing and communication with providers. Protocols for maintaining the safety of community health workers and clients. How community health workers can protect themselves. The modules again. 1, review of cultural competency, humility and trauma-informed care. 2, motivational interviewing. 3, asthma gizmos and gadgets. 4, using asthma protocol. 5, the asthma case study. 6, the asthma home visit. 7, advocacy for housing and healthcare. 8, safety protocols and personal safety. Next slide, please. Here's an example of a community health worker attending the in-person training. Community health worker Martha has been working at a community clinic in Washington State for 7 years. In her caseload of patients she visits with 5 families who have asthma and who live in a public housing community. She wants to know more about how she can advocate for safer housing and health care for her families that she's serving. When Martha attends the training, she will share her knowledge of working in a community clinic with her peers. She will be able to share more about the issues that are faced by her families that she's serving, who may be having their asthma triggered by the environment that they are in and behaviors that they are engaging in. She will review case studies during the training, which highlight local resources and communication tools that she can use to better advocate for her family and be more prepared in facing these types of issues in the future. Thank you. Let me turn it over to Joyce now.
Thank you, Michelle. So, this is Joyce, and I'm going to be going over the Day 1 6 learning modules for the Community Health Worker Supervisor Training. For the supervisor training, the objectives will cover and consist of 1, identifying how community health workers are different from other health professionals. 2, define community health workers, their role and their skills. The third objective would be to examine the roles of shared culture and lived experience played in improving health outcomes for people experiencing large health inequity. 4, sketch the strengths and challenges community health workers bring to their organizations, supervisors, and or patients in clinics and clients. 5, describe the components of effective community health worker supervision, individual supervision, group supervision, and community health worker shadowing. And 6, identify the unique satisfaction of being a supervisor to community health workers. Next slide, please. Day 2 of the Community Health Worker Supervisor Training will consist of preparing your organization for community health workers by building relationships with external stakeholders, by educating staff at your organization about the community health workers' role, managing internal relationships within the organization, and overcoming challenges with an onboard community health worker at your organization. I'm going to give an example of a community health worker supervisor case. So we're going to look at Supervisor Clarissa has been supervising at a community-based organization for 2 years, and now we'll have the opportunity to hire a team of community health workers who conduct home visits. She also, she's also trained as a nurse and wants to be better prepared in onboarding the community health worker team to organization. Also, there's a lot of research. That indicates that community health workers can help people from populations that are traditionally underserved and or marginalized to improve their health. However, much of their effectiveness depends on their organization understanding their roles, educating their staff about their roles, championing their work with all staff, and removing organizational and or system barriers that prevent community health workers from working at their highest and best use. In this training, we're going to explore how to prepare and support your organization to work effectively with your community health workers. So just to also additionally talk about Supervisor Clarissa. When Clarissa attended the supervisor training, she will share her experience as a registered nurse at the community-based organization and explore with her peers the difference between a supervisor supervising community health workers and other staff. She will leave, this supervisor will leave with a better understanding of the role and how community health workers improve health outcomes, and will leave with tools for being an effective supervisor. So now I'll turn it back over to Nuha, who will just talk about and share how to sign up for the training, and then we'll open it up for questions and feedback.
Great. Thank you, Joyce, and thank you previously to Michelle and Maria and Dr. Stout for sharing all the information on what the trainings will entail. Just to mention, the team here is also the lead trainers during the live session training, and Dr. Stout leads the UW iMatter team in developing the online modules. So for King County, we will be hosting trainings in early 2020. Both trainings will be held in Renton, Washington in the Elections Building. So for the CHW Asthma Training, that will be January 30th and 31st. The full day training, so from 9 a.m. to 5 p.m. And the CHW Supervisor Training will be February 6th and February 7th. Today, so you've met the lead trainers, and if you're ready to sign up, you can just email me, and I'll send you a form to get you all signed up to keep up with any of the updates. Most importantly, get the links for the online trainings that we hope most folks will complete prior to attending the live session. So you will go through the online modules that Michelle has covered that included those videos that we watched, and then you'll also just get more information as we near the live session. So again, thanks everyone. We'll open for any questions or comments that the group may have.
Thank you. And Tavish, do we have any questions on our end yet?
We have had a couple come in that mostly concerned kind of getting access to these materials.
Okay.
So Victoria is going to send a follow-up email after the webinar.
Mm-hmm.
Are you going to include the slides or just the links to the recording?
Yes, I'll do both. I'll include both the slides and the links to the recording.
Great. And then the video will also be on our website in the news and resources section.
Okay.
And if anyone has any other questions kind of related to the content, please go ahead and type those into the question box.
And so for those of you who may have joined the webinar late, I just really wanted to summarize the opportunity for folks. So there are two free, very comprehensive two-day trainings available. One is for CHWs who specialize in asthma, and the other is for CHW supervisors in general. So these CHW supervisors do not need to be working on asthma specifically. Did I summarize that correctly, Nuha?
Yeah, that sounds about right.
All right, great. And so those who are interested in signing up for either one or both of those trainings can reach out to Nuha, and you have her contact information on the slide here.
So just to clarify one thing, Victoria, I think our expectation is that people that are currently employed as community health workers and want to take this training won't be exclusively becoming asthma community health workers, but rather have it be another kind of tool in their toolbox for the things in addition to the things they currently do.
That's very helpful. Thank you for that clarification,
Yeah.
Dr. Stott.
We did just have a question come in from Rochelle at Multicare. Will there be training available in Pierce County in the future?
So we definitely invite everybody from Pierce County to attend also the King County training if they're available on those days. Currently, we're also partnered with ACHs down more south in Washington, so Cascade Pacific Action Alliance and the Southwest Action Health Alliance is also will be hosting training down closer to Vancouver and Washington.
Great, thank you. Yeah, another question came in from one of our neighbors in Snohomish County. Will the training be available via webinar or is it in person only?
Well, it's in person only for the in-person training. The online tutorial will be made generally available across Washington State, and of course, the internet doesn't really pay attention to state boundaries either. But we hope to make it available throughout Washington State for ACHs interested in that component of the training.
Great, and we've got another question concerning the home visit component. So is the expectation that the community health worker would go to homes? The way their organization is planning to do this would be through a mental health group at a mental health organization.
That would be the expectation. The model involves 3 home visits that follows a flexible protocol that's flexible based on the needs of the patient and family. But all of this work is predicated on the evidence gathered from the home visiting model. And so it's the expectation that those receiving the training would proceed to make home visits to their clients.
Great, thank you for clarifying.
So while we wait for more questions to come in, I actually have a few questions for you both. So, aside from the more obvious CHW and CHW supervisor roles, what are some other roles that might benefit from this training?
I can think of another role that could benefit, and that would be the MI component of it. MI is very important, and it's very valuable for community health workers working with families, being able to using those techniques to empower the client and or family to be able to set goals, to be able to acknowledge barriers, to be able to empower them to make change.
As you step back and think about it, this model is developed targeting community health workers, but really anyone can make home visits. There's an amazing respiratory therapist at Harborview that makes home visits for people with COPD. Nurses could make these home visits. Physicians could make these home visits, or nurse practitioners, or social workers, or really anybody with an eye towards improving health outcomes for people with asthma, with an attention to the social determinants that you can only address through a home visiting model.
May I add? Mm-hmm. Patient navigators, parent coordinators, family advocates, and promotoras are a bunch of other titles and roles that are definitely very similar and do home visits in the community.
Great. So it sounds like there's kind of a range of roles that would benefit from this training. Thank you. And for organizations, who are really new to the CHW Asthma Home Visit space, it sounds like the trainings you're offering are a really great way to get started. Once folks are trained, can you elaborate a little more on what types of supplies need to be resourced at the organizational level to carry out this work?
Yeah, one of our challenges is identifying ways to pay for the equipment that gets delivered on these home visits. If you include the whole comprehensive set of materials, it's about $400 per household. That includes a HEPA vacuum, a HEPA filter, mattress covers, a safe clean kit, and am I leaving anything out, you guys?
Spacer, a doormat.
Spacer, doormat.
Medicine box.
Peak flow meters, medicine box.
And plastic containers.
Food containers.
Food containers.
Yeah. So, that's sort of the Cadillac version, and you know, I think there's a lot you can accomplish with the Volkswagen version as well. It used to be an inexpensive car. It's not anymore. It was when I was growing up. But we're hopeful that over time, the managed care organizations will appreciate the value and the cost effectiveness and return on investment of this home visiting model, and be able to contribute towards equipment and supplies going forward. Yeah, that's our longer term plan. We have several other shorter term plans in the works that I won't go into because none of them are done deals yet.
Thank you. It sounds like we have one more question that came in.
Yeah, so this question concerns like a hypothetical program that has a number of satellite sites. So the question is, if you're a CHW working at a satellite site, but you were under the, like, let's say the Tacoma Health Department, would they need their own supervisor at the small satellite site, or could the lead of the health department serve in that role?
That's a great question. I think if they're working independently at a site, then someone at that site would need to be identified for them to sort of report to, use as a thought partner, basically be available to them for day-to-day. I also think the way community health workers thrive, like anybody in any kind of job thrives, is being able to gather with people experiencing the same challenges and successes as you are. So I think in addition to that on-site supervision, there ought to be a way to sort of gather up with others from the other sites and be supervised by someone for training, mutual support. You guys want to add to that?
Safety issues?
Yeah.
Mm-hmm. Yeah. And I would say that for a community health worker that is working on at a satellite site, that along with what Dr. Stout explained, I think having that knowledge that that individual can work independently, having that trust that community health worker is able to do their work and is able to carry out their work independently. So building that trust in your community health worker, that the job is being done, they can work independently, and they also need the relationship of others. It's almost like a dual trust that you build with your community health worker. Because they're out in the field, they're doing their job, they're independently and doing that work, and it takes such a supervisor to put that individual trust in that community health worker, and not have to be, for lack of words, micromanaged.
That's the right word.
All right. It seems like we don't have any more questions, but before we wrap up, I just wanted to emphasize how great of an opportunity this really is, and I think in part it's really because of the excellent folks we have here and all of the expertise. I know at the beginning I was able to do very brief introductions, but it really wasn't able to do their backgrounds justice. So if we could go around and maybe just share a little bit more about the background of the trainers and the team, I think that might be really helpful for folks.
This is Neha. If anyone is from Neighbor Care, shout out to Neighbor Care. That was my previous role where I worked with the team of community health workers there in Yesler and with the Seattle Housing Authority. I'm currently really in the process of learning more about liberating structures and different ways of facilitating trainings. So I'm excited to be in a room of folks that are willing to participate. So.
Maria Rodriguez, and I've been a community health worker for about 15 years. I've been since Healthy Homes 2 with Dr. Jim Krieger, and I've just been doing this for a long time. So.
And this is Michelle DeMichio. I have 28 years as a community health worker, 17 being an HIV, STD, street outreach worker, and community-based outreach worker. That's was a lot of group work in all kinds of venues, including prisons, jails, just everywhere. Also led me to work with, exclusively with the Latino community for a while, doing STD work in homes and in groups. So it was very cool. And now I have 11 years with public health as a asthma home visitor, community health worker.
And this is Joyce McCraney, and I have a total of 19 years of being a medical assistant. 16 of those years have been here in Public Health King County, 11 of those years actually at one of our public health most vulnerable clinics, and then 5 years here in the asthma program as a community health worker.
This is Jim. I'm, in addition to being a professor at UW and running the iMatter team, which stands for Interactive Medical Training Resources, by the way. I am a general pediatrician at Odessa Brown Children's Clinic, where I've had the pleasure to work for the last 25 years, and I attend the newborn nursery at University of Washington Medical Center a few weeks out of the year. My research thematically is all around reducing health disparities, a variety of externally funded health services research projects, quality improvement projects, and implementation projects like this one.
Well, thank you, everyone. It sounds like those of you who sign up for the training will be in really good hands. All right, we're going to wrap it up.
Thanks, everyone.
Thank you.
Thank you.
Thank you.